Good afternoon. My name is James Williams. I'm the County Counsel for the County of Santa Clara. Joining me this afternoon, we have Dr. Sarah Cody, our Health Officer and Director of the Public Health Department, and Supervisor Cindy Chavez, President of the Board of Supervisors. We're here with some announcements based on the significant uptick in cases. I know we spoke with you just earlier this week on Monday about what we were seeing and what was happening. And that concerning trend has continued. And because of that continued trend, along with some other local Bay Area jurisdictions, Dr. Cody's taking actions to help try to rein in the surge that we're seeing here in Santa Clara County and what we're also seeing in the Bay Area, across the state, and in fact across the United States. So I'm going to first turn it over to Dr. Cody to talk about that, and I will come back and speak a little bit about, in more detail, about what some of these actions will mean.
Thank you all again for being here for the second time this week. Today I am here, unfortunately, to announce some more sobering news and the actions that we will be taking as a result. First, sort of to explain to you all why we're taking the actions we will be taking, I want to show you again what's happened to our epidemic curve, even since we were here today, Monday. Before I go over these details, I want to say that these trends that we are seeing here in our county are also being seen across the San Francisco Bay Area region, as well as in many parts of our state and our nation. And as we are here today in the middle of November, looking forward to Thanksgiving holiday and other holidays, it is absolutely imperative that we take action now, each and every one of us, in order to get through this. So a little bit about what we're seeing. Here I want to draw your attention again to the far left side. This is our local epidemic curve, what it looks like here in our county. And if you see that orange line, it's the 7-day rolling average of cases reported each day. And what I want you to note is how steep that curve is. It goes straight up. So after a slow drift up in the month of October, around November 3rd or 4th, it started to head straight up. It's the steepness of that curve that concerns all of us and that requires that we act swiftly. As of today, we had an additional 362 new cases reported just today. Our hospitals have 110 COVID patients being cared for. That's an increase from an average of 80 patients that we were seeing just in October. So hospitalizations are rising as well. So today I am announcing, along with colleagues in most of the large Bay Area counties, that similar to San Francisco, we will be closing indoor dining. We anticipate that as of Tuesday, the state will be assigning us to the red tier. We will be making those red tier closures effective on Tuesday. Unfortunately, I think our trends are not headed in a favorable direction for us. And similar to in March, when we had a rapid increase in cases, we may be needing to take additional restrictions quickly. We are watching our data extraordinarily carefully. We are working closely with our colleagues across the Bay Area, and to the greatest extent we can, we are acting together for the benefit of the public. I want to close by saying that we do not take these actions lightly, not at all. These are extraordinarily difficult decisions to make. However, our first priority is always to protect the public's health And the way that we do that is by preventing spread of this virus. We've done an extraordinarily good job so far. We need everyone to stay patient, to hang in there with us, and to do everything they can. Every single action that people takes is going to help keep people out of the hospital. It's going to keep us from needing to order up morgue space, and it's going to enable our businesses to get back more quickly. So it's really important that we all take action now. Thank you.
I'm going to just take a minute or two to elaborate on what specifically will be occurring effective Tuesday. As Dr. Cody mentioned, in Santa Clara County, indoor dining will be closed effective Tuesday. In addition, we'll be moving into the red tier restrictions. The state allows 72 hours for those to take effect, but we're moving up the implementation of those so that the red tier implementation will also occur on Tuesday. What does that mean? Some of the changes between where we're at right now in the orange tier and the red tier under the state framework mean that, for example, fitness centers will be at a capacity limit of 10%, that wineries can be outdoors only, outdoor bars will be closed, bowling alleys and indoor family entertainment centers closed, card rooms can be outdoors only, capacity limitations for general retail and for critical infrastructure sectors at 50%. That's, again, all the state's criteria for the red tier, and those will be going into effect here in Santa Clara County on Tuesday. There's some other more nuanced items, but again, it's all the red tier items that you can find on the state's COVID-19 website. We will be updating the various directives and guidance documents today and through the weekend to provide that information, and those will all be available on the county's COVID-19 website. One of the reasons that we are acting swiftly is because one of the lessons that we have learned, and it was demonstrated to be true here locally in March as well as in July, and has demonstrated to be true across the country, is that actually acting quickly helps bring things under control faster, and that's generally true of something where you have an exponential growth curve like we see with this virus. And so we are moving a little bit faster to implement restrictions that would otherwise, on the state's timeline, take a little longer to come into effect, but that would be coming into effect anyway. And by moving those extra days faster, we will be able to prevent some significant a number of serious illnesses, some deaths, but also try to help rein in the rate of spread in a way that helps us contain things sooner so that we can be at a more stable level. We'll continue to watch what's happening, as Dr. Cody mentioned, and we'll, of course, provide continued updates as we see things progress. But that rate of growth is something that's concerning all of us tremendously here locally and across the region. I'm going to now turn it over to Supervisor Cindy Chavez, President of our Board of Supervisors.
Thank you. And I want to thank everyone very much for being here and apologize for all of the noise. Let me just make a couple of observations. One is that I think as a community, we tried really hard to fight this back. And I know the leaders in our EOC and the doctors across this county and so many of you have really been following every rule you can. And this is really bad news, and it's very hard to hear. But here's what we need. We're going to need everybody's help. these numbers are going in the wrong direction. And when I say numbers, I'm talking about people. We have more people in our community getting sick. We have more people in our community getting in the hospital. And we have more people, more members of our community dying. What that means is that we've all got to dig in and really double down. And let me just say what I'm most concerned about, and I'm saying this to all of you because we really need your help. If we keep going in this direction, we have a lot of schools that are planning to open in January or in the spring. And we know every one of our children, every newborn that's not being able to see faces because they're seeing masks, and we have lots of littles who aren't learning how to work with other littles. We have an obligation, I think, as the leaders of this community, and by that I mean the adults, in really fighting back this virus so that we can get our kids back to school, we can get our businesses back open, we can get our lives back as normal as we can get them. So today really it's bad news, but it is a call to action. It's our time to act. And I know a lot of people feel like they've done everything they can. We're asking those of you who've done everything you can, do a little more. And those of you who've been slacking, we need your help. We need you to wear your masks, wash your hands. We need you to we need people, as Thanksgiving's coming up, it is so hard not to see your family. I know a number of you who are watching this haven't seen parents, and you have parents who are aging. We have got to protect them. And the way to protect them is to wear your masks, wash your hands, stay socially distanced, and let's work together as a community so that we can put our own community back on track. We're off track now. Working together, we're going to get it back. Thank you.
Okay, everybody, we're going to head into Q&A now. So to make sure that everyone's questions are asked and answered, I'll be calling on you. Devin, first question.
The question was around, are the measures that we're taking, are we sure that they are going to have the effect that we want? What we know about indoor dining is it definitely is an increased risk for this virus spreading. And that's because it's an indoor environment where you can't wear a face covering because you're eating. And there have been a number of studies that have demonstrated that indoor dining is an increased risk. We also know that as the prevalence or the amount of virus in the community that's circulating, as it goes up, the chances that you would have transmission in indoor dining and other settings where you have to take your face mask off and you're in a group also go up. And so by closing indoor dining, we're preventing having that be an additional area where the virus really accelerates. Our dining rules are very clear about what constitutes outdoor dining, and they're designed to ensure that it truly is outdoors, meaning that you're getting the natural air exchange and airflow. I want to remind everyone that each of these measures by itself is not 100% to prevent spread. We have to layer them all together. The analogy that we like to say is it's like layers of Swiss cheese. If you just have one piece of Swiss cheese, a lot of the virus is going to get through. But if you have many layers, each one adds another layer of protection. And so outdoors, safer than indoors. Wearing a face mask, much safer than not wearing one. More distance, much safer than less distance. And less time in contact, much safer than more time in contact. Thank you.
Okay, next question. Right here.
The reason why we are here today making this announcement and have made this decision is precisely because that curve is so steep, it is going straight up. We know that even if we take dramatic action, it will take time to turn around. It always takes time to turn around. But different than in July, you can see there it was almost as steep, but that was in the summertime when it was a bit easier for people to take advantage of outdoors. So we're taking these action now because we know that Thanksgiving is approaching, winter holidays are approaching, and that's when people want to gather. My strongest recommendation is that to the greatest extent possible, gatherings still occur outdoors, that it's with very few households. The state has a limit of 3, and that even being outdoors, that people are still distanced and wearing their mask. That is the safest way to see family during the holidays and to keep it short. Thank you.
What have you learned from contact tracing? And to the best of your knowledge, how and in what settings are people getting sick?
We, as you know, have scaled contact tracing here in Santa Clara County to a very large workforce. Contact tracing is one of those layers of Swiss cheese that I mentioned before. It is one method of prevention. Contact tracing is most effective looking forward, so preventing contacts to a known case from continuing a chain of transmission. Contact tracing is not well designed for looking backwards to understand where transmission is occurring. So we have other methods to help us with that information and to guide our decisions.
Well, if not contact tracing, what have you been able to determine about how people are getting sick and what behaviors are putting them at greatest risk?
The settings and the behaviors that put people at greatest risk are ones that are indoors, particularly where people cannot or do not wear face coverings. I want to remind everyone that just because you're with family and friends doesn't mean that they can't be infected. They may feel familiar, but they may be just as likely to be able to spread the virus as anyone else. And that's why in any setting, staying outdoors and wearing a face covering is the safest. Sure. Today, we had an additional 362 new cases reported. They are fairly recent, so these are cases where the specimen was probably collected within the last week. In addition, we had 4 new deaths reported, so our county now has a total of 444 deaths. The point that I was making earlier is that in October, our case rates, the 7-day rolling average of new cases each day, was rising, but it was rising slowly. What's very worrisome is that right now the rate of rise is very fast. We were fairly steady over the entire month of October, and in early November, around the 3rd or 4th, the rate of rise took a dramatic, steep increase.
Steve?
I'm looking at the chart and I see a big rise right after 4th of July, another one after Halloween.
We don't know for certain in that we haven't traced back to Halloween gatherings, but the pattern that we have noticed is that after major holidays such as Memorial Day, 4th of July, and Halloween, we do tend to see an uptick in cases. And that is why we need everyone's help before Thanksgiving and the winter holidays in doing everything that they can to curb the spread of this virus.
Rob?
Doctor, we're hearing that perhaps at the federal level, the Biden administration said, sort of taking a look at a complete lockdown. Your take on that? Is that something that's possible here? Would that work?
What I can tell you is that here in the Bay Area, when we asked everyone to shelter in place in March, we prevented many, many, many deaths. We know that it works. We also know that we're now many months into this pandemic, and the situation is very different. So the honest truth is I don't know. The best thing that we can do here locally is continue with our risk reduction and try to adapt with living with the virus. But that means that every single person has to think really carefully about what they do and whether they are risking getting the virus or spreading the virus. So it means every single person has to really dig deep and maintain their patience for a little bit longer.
Back to you, Devin.
Have you noticed any demographic trends in terms of who is getting sick? Is it the old? Is it the young? Is it people that are college age? Is it in targeted zip codes? What do we know about those?
The question is about what do we know about who's getting sick? The trends that we're seeing here now with the steep uptick are actually fairly similar to the trends that we've been seeing for quite some time. It's just that they're getting more pronounced. And that is that the steepest case rises are in young adults, 18 to 34 years. The communities with highest rates are still mostly in East San Jose and Gilroy. However, we are also starting to see increasing rates in other communities in the county, sort of around those communities and in other places as well.
I think that's it for questions.
I had one question for
Last question.
Chavez, if that's right.
Sure.
So we're talking about new restrictions at a time in which we do not have any kind of aid package. Can you talk about, concern of a lot of businesses that we're hanging on by our fingernails and now, new restrictions are made?
Yeah, the first thing I would say is that we all, as a community, have an opportunity to stem this. And I say that because we, as a community, we want every business to be open. We want our schools to be open, and we really have to work together to get there. As it relates to aid packages, I have to say one of the reasons I'm most excited about the recent elections is my hope is what that means is more resources from the federal government, more resources from the state that can really help not just our businesses but also with unemployment insurance and other high needs. The county, as you probably know, is looking at a number of different ways that we also can participate, and cities across the county have done everything from small business loans to making grants. We're going to have to take a look at all of that again.
We're going to now have press statements made in Spanish, Vietnamese, and Chinese, and then provide Q&A in multilingual afterwards. Go ahead. We're still streaming, so if you're going to move your cameras, please avoid behind.
Muy buenas tardes. El día de hoy, nuestra oficial de salud, la doctora Sara Cody, acaba